Hi guys. Today I want to address some questions and issues that might have to do with your pelvis and finding neutral pelvis. Now, in an athletic standpoint, some people might find it hard to really to find the engagement of like their back muscles, their butt muscles, and their lateral hip muscles. That have to do with the tilt of your pelvis. And on another standpoint, people might be wondering, like, or might be dealing with issues of pelvic floor dysfunction. And the way we stand and sit and walk, and with our pelvis either tucked so that our tailbone's coming out in front of us or underneath you and your pubic bone's pushing forward, or untucked too far, could both cause dysfunction in those areas of whether you can activate your butt muscles or you can actually, over time, lead to some pelvic floor dysfunction. So what's pelvic floor dysfunction? It's, it's a much deeper topic you can get into, but the pelvic floor is like a hammock. It connects it's like the muscles that connect the back to the front of the pelvis underneath you, and they kind of hold all that space underneath, and they serve the function of things like holding your organs in place and also controlling your elimination. So when people find, which might seem a common symptom, but when you find that maybe you pee a little bit when you sneeze or laugh or jump or run, those are symptoms that the pelvic floor is actually not doing its job properly. And that might be caused because your pelvic floor might not just be in the right position. Now, how do you find the pelvic floor, and why is it important? Is because before I get to that, also another issue that comes with that is that how you are holding your pelvis in this tucked or untucked position may also be putting strain on your lower back, may also even cause hyperkyphosis in the upper back over time. So it really does affect the entire body. So how do you find the neutral pelvis? And one is you have to kind of find these bony markers of the pelvis here. So, when you put your hands on your hips, you can feel the top ridge of the pelvis, or the ilium here, and the outermost and most frontal bony protuberance there, they call the ASIS, which is the anterior superior iliac spine. And those 2 points are our first 2 markers. And the second point is, if you trace that down along this little triangle in those hip flexors, all the way down to the center, almost between the legs, but slightly above, you'll find the pubic bone. So it's the ASIS and the pubic bone. We want those to get the pelvic floor literally underneath you, and to get to a place where you can actually engage your butt muscles best. You want those 2 bony markers stacked vertically. Now, sometimes it's hard for us to see or feel just by putting our fingers there, because a lot of us have a little flesh around that area, and you kind of have to push into that space to kind of figure it out. And so that's not that easy. So here's a nice tool, very complicated technical tool that you can use, is just a couple of pencils, or any sort of like pole or stick or anything that just comes, that can bring the markers of our bones a little bit away from our body so you can see it better. It's also really good to do this in a mirror. But what I'm going to do is I'm going to put one of those pencils on the ASIS, and I'm going to put another pencil way down on the pubic bone. And then I'm going to look down, or in a mirror, and see if they are vertically stacked. So right now I'm kind of intentionally not doing that. I'm standing how I used to stand all the time, where that pubic bone is way far in front of the ASIS. It means it's not stacked, which means that I'm probably decreasing the function of my butt muscles and also decreasing the function of my pelvic floor. So what we want to find is when that's more vertically stacked. And it might feel really weird for a lot of us. And one of the reasons it feels that way is because we've spent so long adapting our muscles around our legs and our back to be in a position that we happen to be in most often. So I want to demonstrate one thing or a way to correct our most common position, which is sitting in a chair. So oftentimes, actually most of the time, chairs are unfortunately a terrible design for the human body. And especially if there's a back on the chair like this, they almost 100% will encourage you to fall into a curved, rounded back and tucked pelvis. So if I were to put those pencils on the pubic bone here and one up on the ASIS here, you can see like this bottom pencil is like way out in front. I'm really tucked and round in my lower back. So one tip right away is, if you want to start to sit with better posture, is you gotta get your back off of the back of the chair. Stools and benches are nice because they don't have backs in the chair, so they can actually help you get to that point. But once you sit up, I would suggest sitting towards the edge of the chair too, and try to find this tilt of the pelvis where you want to get your butt to literally go back behind you a bit. And if I go this far, now I'm finding vertical. And for a lot of people, that feels very, very strange. So notice if you can see this curve in my lower back, that's what you want. If I were to fall back into a tucked position again, notice how that curve disappears and this becomes very flat. That means I'm actually flexing that lower spine and putting the pelvic floor in front of me. So I encourage you to create that sway of the lower back. Now notice I'm not doing that by lifting my chest up, which can create the illusion of the sway in the back, but that's happening from way up here. We want that to happen way down at the pelvis. So my ribs are down, and I'm just letting my pelvis tilt a little bit forward to the point, and you can use pencils to find this, where the top bone of the pelvis is vertically stacked over the bottom pubic bone. And you end up actually sitting more on your thighs than on the back of your sacrum. Now, for a lot of us, there might be a lot of tension in your lower back, and that might be kind of hard to find, and it might feel uncomfortable. So you want to take it, in degrees as a progression over time, and just know where your neutral actually is. Now, another tool you could use is something like a half cylinder, half foam roller. You can also use just a rolled up towel, but I like these because they really create kind of like a rocking horse sort of, or a rocking chair sort of motion here. And I'm going to put it flat side up underneath me, and I'm going to sit onto it. And that just creates a surface in which I can find this tilt of the pelvis a little bit easier. And this is an exercise in and of itself that in the nutritious movement world, they call this the click-clack exercise, where I'm not trying to lift my chest up to make this happen, but I'm trying to just get into this hinge of the hip, tilting of the pelvis a little bit back and forth. And then find a spot where that is neutral, and you can use your pencils for that. And try to find that seat, most of the time, whenever you're seated, where you're in this position, you have that little bit of the sway of the back. And it's going to take time to feel natural. And the cool thing about something like this cylinder is that I actually carry a half one around with me, and I bring it with me on the bus and on the subway, and it just encourages me to stay with a little more aligned spine and healthier pelvic floor most of the day. Anyway, so those are a couple of different things you can play with. Just finding the tilt of the pelvis, really using like a pencil to truly find your neutral pelvis, which may not feel normal, but know that should be the natural curve and tilt that you're aiming for. Find that your pelvic floor gets stronger, your butt muscles turn on more, and you start to feel stronger in your hips. And your lower back might actually start to feel better if it tends to give you a lot of strain. So have fun with that, and I will see you next time.